the comments I had written down even before the panel sat down was the fact that it's no joke that the American system of caregiver support is woefully inadequate. AARP had just a recent report a couple of months ago that was talking about the woeful shape of the caregiving economy. But as our next conversation will indicate, it's not hopeless everywhere. In Washington State, they've emerged as an innovator in terms of supporting family caregivers and providing long-term care support and more health options than any other state. And I am lucky to have Susan Golden in conversation with Jilma Meneses, who Susan will introduce in a minute. Susan is a longtime friend and colleague, was a DCI fellow many years ago, and then joined us as a visiting fellow at SCL for 2 years after that. But more importantly, she has long been involved in caregiving, both as a caregiver and then taking that experience, has started writing about the caregiving economy, caregiving innovations, and also the business of longevity. So at that point, I'm going to turn it over to Susan.
It's absolutely true. The last session teed us up perfectly for the discussion. And we're so honored that you're with us today. Thank you for being here. So as you've heard throughout this summit, we have a very inadequate caregiving system. And we've talked about a number of things that we need, but what we really need is policy that's going to make a difference. And we are so fortunate that we have one of the leading innovators in policy with us today to tell us about how Washington State has gone about this in a way that can be a model for many states throughout the country and could really be a model for federal policy going forward. So we're here today with Secretary Meneses from Washington State's Department of Social and Health Services. She was appointed by Governor Inslee in 2021 and oversees the largest state agency with over 17,000 employees serving approximately 3 million people. Her Department of Social and Health Services is inclusive of aging and long-term care, behavioral health, developmental disabilities, and other public benefits. But most significantly, she and her team were instrumental in the major legislative advances that have been implemented in Washington State. So we're here to learn from the best practices and to inspire all of us in our different states and how we might implement change to support the 53 million unpaid caregivers, and as we heard, over 61% of them are women. So this is many reasons why we need to fix our structure in the U.S., both from caregiving and from paid family leave. So welcome.
Thank you.
And if you can, because you've educated me, even though I've written about what you're doing in Washington State, I learned so much in just talking to you in the past couple of weeks about how extensive it is, how well thought out it is, and how it could be a model to grow things further in Washington State. So if you could tell us about WACARE, which is I think how you pronounce it, and the process of how Washington State was able to implement this, and who were the key players that made it happen.
Thank you. And first of all, thank you all for being here today. I know it's a late day. I appreciate you for being here, experts and brilliant people I see in the room. So WACARE's fund has been in the works for several years, and actually the brain trust of all that's probably started 30 years ago, but certainly in the last 5 years is when it's taken most effect. And in July of 23, it really rolled. So what WACARE's fund is, it's a long-term care insurance that we as Washingtonians pay into. We pay the state 0.58% of our compensation into this fund, and they manage it for us. At the end, in about, I would say 10 years, I will be able to access that fund, which is only without inflation, it's only $36,500. However, it'll go up with inflation, and I would suggest to you, it's a start. It's just the beginning. If I, who was born prior to 1968, okay, I had to be in needed long-term care now, I would have to invest into the fund for at least a year for me to access some of that money. If I were working 3 years, regardless of my age, and I became incapacitated and needed that fund, I could access it then. But otherwise, I have to work in the state of Washington with any employer for 10 years. And there could be a break in service after 5 years, but as long as I invest in it for 10 years, I will eventually have access to that $36,500 plus inflation and so forth. And again, that's just the start. Our hope is that we can increase that. And what WalkCare's fund would pay for is anything that I would need as an older person if I were incapacitated or elder and needed care from a family caregiver, needed transportation, needed meals, et cetera. Anything that you would access now if you, for example, were in assisted living and so forth. I could use that money towards that, those services. Again, including paying an unpaid family caregiver. Now, we do now have a program in the state of Washington, which is the paid family caregiving program. But putting that aside, what other questions do you have for me about WalkCare?
So the reality is, depending on what state you live in-home care, or if you were to pay somebody with that $36,500, might not go too far.
Right.
I mean, in New York State, I'm told it's $20,000 a month for in-home care, minimum of 10 to 12 in most states. So what was the vision behind offering that amount of money? I mean, it's a great start because there's no other state in this country right now that offers that. But where did people think that money might best be used for somebody who was going to receive it?
Well, as you've heard, 1 in 3 people over the age of 65 suffer from poverty, correct? And so this fund, or this retirement fund is what I really call it, even though it's not for retirement, but it's for long-term care, is a way to particularly help those that suffer from poverty. And it's also the beginning to help those at that next level who are not independently wealthy, with the hope, again, that the WalkCare's program expands and that fund will grow, and maybe to the point where Washington will allow me as a Washingtonian to invest more than my 0.58%. Right now, I can only do, that's all that is taken from my paycheck. But eventually, hopefully, and with the legislation passing and others in the court, we could potentially invest more, and it'll help various levels of income brackets, not just those 1 of 3 who perhaps are suffering from poverty. And again, if an individual is suffering from poverty, having a meal, having someone come in to help with daily chores is extremely important. And even though right now it's just $36,500, it's going to go a long way, particularly for those suffering from poverty.
That's great insights for us to have. And given that, as I understand it, you said you can use those funds to pay a family caregiver. And that's novel. I mean, until now, everybody's basically been a daughter or son doing what they feel is their family obligation. But for the first time, somebody's recognizing that their time is valuable and that they're often giving up their employment. So that to me is a pretty exciting, but there are some exceptions. Could you share who cannot be paid with those funds, as I understood it?
Oh, well, were you thinking of a different?
Oh, is that a different fund?
A different
Okay.
program.
All right.
So in the state of Washington, we have family caregiving legislation. So the state of Washington, family caregivers are now paid. A person who wants to become a family caregiver of their mother, of their father, of their grandfather can apply to be paid. And the way it starts is that family member, let's say grandma, hires the individual. So she's actually the employer through the Consumer Direct Care of Washington. The Consumer Care of Washington is the actual employer, but the grandmother applies for that individual to be the family caregiver. Anyway, if the individual family caregiver is accepted, and they do have to go through a background check, they have to be 18 years or older, they have to be eligible to work in the United States. there are a few other requirements. But anyway, assuming that the individual qualifies to be a family caregiver, that individual will get paid up to 393 hours a year for that individual. Now, the individual also has to qualify. So not just anybody can apply. The individual grandma has to meet certain economic thresholds, income thresholds. And Medicaid is obvious. If they qualify for Medicaid, they'll qualify for this. But if through an 1115 waiver that we got from the federal government, CMS, and the threshold has actually expanded, so it's more generous. As long as they meet those requirements, the grandma, let's say, she can apply for her granddaughter to be her family caregiver. The exception, that the person that grandma cannot hire to be her family caregiver is her husband or her partner. So spouses are not eligible to be paid family caregivers at the moment. But my wish list is that someday they will be. And in fact, we're working on legislation right now to allow spouses or partners, domestic partners, to be family caregivers.
So those are two inspiring new programs that have been implemented in Washington State. Can you give us a little bit of the background? What made this happen in Washington State and when it's not happening elsewhere? Was it, you had shared with me the history of Governor Inslee and the importance of this. And I was just wondering if you could tell us a little bit about the process that other states might learn from.
Absolutely. This is leadership from the top. If you don't have your top leadership in government backing you up, it's not going to happen. Governor Inslee, we've been blessed. He's in his third term. He's in his last term now. But and he could have gone for a fourth term, but chose not to. Anyway, he has been a champion from day one for both paying family caregivers and the Walk Cares Fund. In fact, I think it was either this morning or yesterday, he had a big press conference because November is Family Caregiving Month. And there was a big to-do in Washington about it. But yes, he and the legislature have been very, very supportive of this. There's a proclamation that he issues every November on the matter for family caregivers. Absolutely. And of course, my staff, not me, my staff, B. Rector, who's my Assistant Secretary of Aging and Long-Term Care, is exceptional. She's well known around the country for this. She's an innovator, and her predecessor, Bill Moss, as well. They're both excellent and have been big champions in the state for this work. But certainly, the Governor Inslee has been extremely, and his wife, the First Lady, have also been very, very, very instrumental in the passage of paying family caregivers and the Walk Cares Fund.
I love the concept that this is just the beginning, that you've laid some groundwork, some structure into the system, and that you're hoping to build upon it. And I think that's just phenomenal.
Yeah. And the fund, the paid family caregiver fund, it truly is it's a partnership between the employer and the employee. And so the employer in the state of Washington will pay about 27% of what is required to pay into the fund. The employee will pay another 75% or so of what's required to pay if you're working throughout the life of your working years. And then for the individual, it doesn't matter if you are you can access this whether or not you're still working. So
this is phenomenal. And then tell us about the history of the paid family leave policies in Washington State. Because I don't know if most people recognize in the room, less than half the states in this country offer a paid. We only have unpaid family leave by federal legislation.
Right.
So if we could hear about that history and what's being offered and how unique that is.
Right. Oh, so I think there are 14, 17 states that offer paid family medical leave, and certainly Washington is very much leading in that. In Washington, you have to work approximately 820 hours compared to the 1,250 for family medical leave to be eligible. And it really is, again, you can work for any employer in the state of Washington and qualify And with that, you can pay, again, you can be compensated while you take care of grandma or while you take care of another family member. It's very similar to FMLA, with the exception of the number of hours. And there can be more than one qualifying event that will give you more than 12 weeks for paid leave. So the tradition is FMLA 12 weeks, correct? Well, with this, you can get 12 weeks plus more, depending if you have other qualifying events.
And so a policy like that really can impact, as you told me, generational poverty. It could impact caregiver stress. These are just some very important issues that the state of Washington is dealing with. When you told me it was over 820,000 caregivers in your state alone for who are caring for older adults.
Right, exactly. 820,000 is a lot for us, correct? Right now, we are paying approximately about 300,000 out of those 820, so we expect more to be applying. And as has been noted throughout the sessions today and yesterday, when you provide support to a family caregiver, you're providing support to her or his loved one, and really you're providing economic support for your community, because that means that that person will maintain employed, right? Otherwise, they might have to stop working to take care of their loved one. So it's a huge economic benefit for that individual, for the family, for the client, and for the community, for your economy in your area, and so forth. And of course, having that self-worth of getting a paycheck, not having to leave grandma alone, right, is a huge benefit. I don't know about you, but I had grandparents, my 4 grandparents lived to be either 100 or 105. And the main reason they lived to be that age, maybe their DNA, okay, but really the main reason, I think, is because they were surrounded by family until the day they died. So for that client, for that individual to be cared for by loving family members who understand their culture, who understand their language, who understand what they like to eat or don't like to eat, their cuisine, wherever part of the world they're from, is incredible. It goes a long way compared to if I were 90 and we're in a nursing home and I didn't speak English and my care providers didn't speak English or my language, and they didn't know what I like to eat and so forth. It's a different concept, right? So that's the purpose for these programs of paying family caregivers, Walk Cares Fund, and paid family leave, is to really provide the individual what they need to benefit themselves, their family, and their greater society. I think it's a win-win.
Yeah, it's a model, I mean, for so many other states. Do you collaborate with other states to learn what they're doing? And do people, I imagine many states are coming to you saying, how'd you get this done? How can we get it done?
Oh, absolutely. You invited us here. There you go.
Okay.
Yes. And my staff is also invited. My B is on several national committees as well. And ARC has been very supportive of us as well. We're leading in the nation in this area for sure.
So what's on your policy wish list? This is a place for audacious thinking.
Yeah.
What would you love to see happen?
Well, I definitely want the family caregivers to have even better benefits. Right now, they are employees, like I said, of Consumer Direct Care of Washington, which partners with dciX, our agency. That entity, Direct Care of Washington, has a board. It's separate from us. The employees are part of a collective bargaining agreement with SEIU. They're members of SEIU. And so the union will obviously negotiate the terms of their employment for them, which is good. And my hope is that right now they're getting in between 18 and 21 and change per hour based on their certifications as well as their experience. But my hope is that will grow. And because, as you know, making $18 an hour is still not a sustainable living either, right? So my hope is that that can increase, and These folks get health benefits as well and retirement benefits. And so the richer those benefits are, including, and by the way, they not only get paid, but they also get training. They receive or can request tools for their house, for the environment to make their jobs better. My hope is that we can continue providing them the individual caregiver services and support that they need to better serve their grandma or their grandpa or whoever it is, loved one it is. So that's really, and of course, the other wish is that Walk Cares expands.
So we've heard in this summit reference to the fact we need public-private partnerships is a real important role for business here, and more businesses are providing caregiving benefits. But with that, having the supplement of state benefits, I think sounds like an enormous game changer to inspire other companies to make sure that they're providing care benefits and care support in Washington State. Wouldn't it be great to hear that 100%, not just 40% of employers in Washington State and throughout the country provide these kind of benefits going forward?
Absolutely, absolutely. Yeah, that would be great.
So we have a bit left of time. I just want to throw it out to you if you all have questions or if you have a wish list of policies that you would like to see happen. I have a long list personally, which I can share.
Thank you for an excellent presentation. I think it's really exciting, the forward thinking, but I would think it also would help the Washington state need for employees to come. You know, that when you're showing such forward thinking and you want the best talent, that would be a real factor in just helping sell why they should move to Washington.
Yes, absolutely. Come to Washington. We love our state. And I love California too. I grew up in California and I've worked in California.
Cal undergrad.
Yes, yes. Grew up in San Francisco, so.
Power of
Hi, I'm Deborah Cotto. Very nice. I was just curious because a lot of times when people need caregiving, they suffer from some cognitive impairment. And what you described in Washington State is it's actually the grandma who does the hiring, but often clinically that's not what happens. So I'm just wondering how administrators work around that.
Yeah, that's an excellent question. So I simplified when I said grandma, right? That was just my way of simplifying. What actually happens is that my department staff at the Department of Social and Health Services does an assessment. That assessment is crucial because a social worker will come into the home, will visit with grandma or grandpa or whoever it is, right? They will visit with them to see to understand what their care needs are. Do they need bathing? Do they need food preparation? You name it, right? Do they need medicine distribution and so forth? Do they need transportation, et cetera? Our social workers do that entire assessment. And based on that assessment, then that social worker recommends to the Consumer Direct Care of Washington how many hours that family caregiver should work with grandma. So legally, it's grandma is the recipient of the care and technically the supervisor of the family caregiver, but it's truly not grandma who's doing the assessment, and it's us, and it's the Consumer Direct Care of Washington that's the real employer.
We've talked over the course of the last 2 days about how people often will likely have to leave the workforce for caregiving duties, often women.
Yep.
So I'm wondering what the business community, how they're reacting to this off-ramp that the government is providing, and more precisely, are they going to provide on-ramps back into the traditional workforce when family caregiving is no longer necessary?
I would hope so. And I would hope, so talking about wish lists, right? I think that could be part of the wish list, is to provide programming back into transitional employment, back into to the workforce for those individuals who've been caring for their elders and now maybe their elder passed and so forth. They absolutely need to be back in the workforce. So that is, I would love to see more transitional paths. Absolutely.
Thank you for a great conversation. It seems to me that caregiving, in most instances, can be a hair on fire moment, right? Father's fallen down in the kitchen, got to leave work, run over, take care of him, don't know what to do, et cetera, et cetera. So there seems to be, and you don't think about caregiving till that moment happens, but maybe there's some education awareness that could be built, some consultation that could be built, so that people who are going to be giving that care have some sense for what should be provided, who to call, where to go. So what are your thoughts on how to avoid that hair on fire moment?
Yeah, I would 100% agree with you. And so part of the service that we provide to the family caregiver is exactly that, is training. Training as simple as how to pick up grandpa or dad off the floor, grab him by the arm, right? You can't do that. And so training on how to prevent accidents, training on how to hold grandpa or dad, training on who to call, et cetera, basic CPR, and so forth. So the caregivers have to go through certification. And again, depending on the number of years they have with the individual, either that individual or others in caregiving, they will get a slightly higher wage. Certification is a big deal.
What they provide, if we could provide that on a national level, that everybody gets trained, everybody knows where to go to get information, because it is an incredibly complex maze to go through. I often say I speak English. I have a doctorate in health services from a wonderful institution, and I could not navigate the care system in the United States for my own mother. And if it's like that for me, what's it like for everybody else? And turns out it's like that for everybody else.
Yeah,
And it's just tragedy that every family goes through this over and over. So it's fixable. You've taken a great first many steps. I mean, not just one step, many steps. That I'm really inspired, and I often quote the work that you're doing in Washington State. I hope this goes forth here, people from other states, so that you become advocates in your state. And then maybe we can, get national policy. There, for a moment there, we thought we were going to have it back in May of 21, but at the moment we don't. Any other questions? Look at me, I'm not even a second over.
Great. And it's a bipartisan issue as well in Washington, which helps, right?
All right.